When the Ministry of Health released the 2016 National Health Facility Survey last month, inaccurate diagnosis and the lack of basic treatment drugs and equipment, especially at primary healthcare facilities, were identified as major challenges confronting the nation's healthcare system. This meeting between the Executive Director of the National Primary Healthcare Development Agency, civil society organizations and journalists in Abuja is organized to provide explanation to some of the failures in the system and how the agency plans to address them going forward. First, the Executive Director of the National Primary Healthcare Development Agency explains the reasons behind a series of disease outbreaks the country experienced recently.
What our data shows to us is that routine immunization is not as good as it should be. Less than half the population of eligible children are getting the vaccines that they need to get. That is just the truth of the matter. It's not a question of trade blaming. It's a question of how do we deconstruct, how do we unpack routine immunization and address the challenges. That's what we're going to prioritize at NPHCDA.
Dr. Shuaib also states how he intends to reform the agency, including that of decongesting the headquarters in order to change the narrative.
Most of our populace live in the rural areas. So instead of having most people at the headquarters, we've identified senior and very experienced directors to move to the zones as zonal directors so that they can engage with governors, they can engage with traditional leaders and solve problems without even coming to Abuja.
It's been argued strongly by healthcare experts that the strength of any nation's health depends on the primary healthcare system. Hence, participants in this conference hope to see how the primary healthcare agency will match its words with action.